In this video, we're going to discuss the drug Tegretol, or the sustained release form of Tegretol XR, or Carbamazepine. The generic form of this drug is Carbamazepine. This is an anti-seizure drug that is usually used to treat tonic-clonic seizures, which are seizures that manifest themselves by having a stiff phase and then a twitching phase and confusion thereafter. Complex partial seizures are also treated by Tegretol. Complex refers to the patient losing consciousness, and partial implies that the patient is having problems with their arising from a certain portion in the brain or a certain focus in the brain. Tegretol can also be used to help stabilize the mood in conditions such as bipolar disorder. It is important to know that Tegretol can worsen absence seizures, known as staring spells, and myoclonic seizures, which are episodes of jerking that take place. So if your seizure frequency or symptoms get worse or prolonged in duration, this may not be the right medication for you. It is very important that you discuss this with your neurologist. You can take Tegretol with food to decrease any upset stomach. The tablet form comes in conventional tablet or chewable and can be given 2 to 3 times a day. When taking the suspension form of this medication, it may be needed to give this medication 3 times a day. So do not give this medication with any other liquid medications because there may be an interaction between both medications. Tegretol XR and Carbamazepine are extended release forms of the medication and are given only twice a day. In special situations, Tegretol can be given only once a day. You should not crush or chew the tablets. Do not stop this medication suddenly without your neurologist's approval. Suddenly stopping this medication can make seizures worse. Carbamazepine is listed in pregnancy category D. This means that there is a risk to the baby, but the benefits may outweigh the risk for some women. Researchers are just beginning to evaluate the development of children who are being exposed to carbamazepine during pregnancy. Some studies have found slightly increased risks for developmental delays in children exposed to carbamazepine versus children not exposed to carbamazepine or other anticonvulsants. Other studies have found no differences in development in exposed children versus unexposed children. Further research is needed to answer this question completely. All women who are capable of becoming pregnant should have at least 0.4 milligrams of the vitamin called Folic Acid every day because it helps to prevent one type of birth defect known as spina bifida, in which the spinal cord is not completely enclosed. Women at high risk, such as those with a history of this kind of defect in previous pregnancies, should take 4,000 micrograms or 4 milligrams daily beginning before they become pregnant. In general, the risk of defects is higher for women who take more than one type of seizure medicine and for women with a family history of birth defects. You should call your primary care provider and neurologist immediately if the following side effects occur: nausea and vomiting, rash, fever, sore throat, mouth ulcers, and frequent infections, paleness, weakness, easy bruising should be noted, and your doctor should be contacted. The most common side effects when the medication is first started are headache, tremor, drowsiness, dizziness, nausea, diarrhea, and abdominal cramps. This can be helped with taking the medication with food. Tegretol can also cause balance problems when it's first taken. The most common side effects when the medication is increased are balance problems, visual disturbances, sleepiness and lethargy, and tremor. These effects should get better with time as the body adjusts to the medication. If they are severe or persist or worsen, please inform the neurology clinic. The most common side effects when the medications are chronically used are hyponatremia. This is a condition that can manifest itself as weight loss, confusion, muscle cramps, headache, dizziness, loss of balance, and increased seizures. Tegretol can also cause increased weight gain, which is an issue when the medication is used chronically. Bone loss and osteoporosis are also problems known with chronic use in Tegretol. Other side effects that may occur are fatigue, blurred vision, swelling, and decreased urination. Your neurologist and our primary care provider may order blood tests to monitor for possible signs of blood cell problems, liver, renal or clotting problems, as well as for the proper level of the medication. It is important that you keep those appointments. The normal blood range for carbamazepine is 4 micrograms per milliliter to 12 micrograms per milliliter. But it is important for you to remember that your physician is treating you and not the numbers. Tegretol can interact, interfere, and be affected by many medications. It is important to inform any healthcare provider who cares for you that you are taking Tegretol. Some of the medications that Tegretol can affect are erythromycin, otherwise known as Eric, or erythrocin, fluoxetine hydrochloride, otherwise known as Prozac, TCAs known as Elavil, St. John's wort, propoxyphene known as Darvon, diltiazem known as Cardizem, benzodiazepine, Nizoral known as ketoconazole, verapamil known as Velin or Corvera, cimetidine known as Tagamet, warfarin known as Coumadin, theophylline known as Theodor. Tegretol can also affect statin drugs known as Lipitor and Simvastatin. In specific, carbamazepine interacts with the following anti-epileptic drugs: lamotrigine, known as Lamictal, topiramate, known as Topamax, tiagabine, known as Gabitril, valproate, known as Depakote, oxcarbamazepine, known as Trileptal. Carbamazepine can decrease the effectiveness of oral contraceptives, so other forms of birth control should be used. It is important to remember that all anti-epileptic drugs are thought to increase the risk of suicidal ideation. Please inform your physician of any signs or symptoms of depression, such as feeling guilty, insomnia, decreased energy, apathy, and an overall agitated state.